Okay, so here's the deal. So the techs will set up the whole pump thing for you. It says on the setup that nitro and epi will go here. I normally don't spike those until I know that we're gonna use them, but everybody's different. Like Hussey will say, go ahead and spike them all because the patients get charged, but LaDonna will be like, no, wait and see. Because if they have a good EF, they won't need the epi. And then you program the Neo. So this LR carrier is at 100 and it has what's called the 6 gang, and you tourniquet it here, and that is what you'll plug into your central line. So it's just an LR carrier at 100. Neo drip, ready to go. TXA on the syringe pump. Look at like the sheet for all the doses and stuff. And then if they have an A1C greater than 7, they'll probably need insulin too. Dr. Coleman will want a Precedex drip, so you'll have to be sure to get that. And then you come over here, all your stuff is like done by the techs in 0, just like make sure all the bubbles look good. Don't take your leads with you to pre-op, don't take any of that ish. That's your central line stuff for your ologist. And over here, so instead of nasopharynx, they use an esophageal probe. They only use this tape, no pink tape, and they put the benzoin on first. Loop the eyes. You're always going to use rocks, always have airway stuff out. 7.5 tubes for women, 8.0 for men. And OG tube you'll put in at the very end. Second IV, large bore. Over here, so this is your Swan stuff that you'll hand the ologist. Pacer box, you just have to check the battery. Train of 4 monitor. And cerebral oximetry, Dr. Slaughter, and like sometimes Dr. Lauda will ask you to use that. The techs will program it for you, and those things are right here. No bear hugger because there's an underbody thing that the techs will turn on for you. This is your A-line kit because you have to go put it in sterilely in pre-op holding. So everything's in there, like lidocaine and arrows and stuff, and I bring an extra bag. So you need sterile gloves, I bring some extra arrows, wrist pad, and then stuff to send off labs. Most of the time, people want you to go ahead and send a baseline gas, baseline ACT, and then I call the blood bank and see if they need a second pink top for their typing screen. So this comes off the end of the A-line. So you like cap it there and just use this to draw your labs, like bring a 10cc syringe or heparinized syringe for gas or whatever. And you can just hook this up to the A-line once you place it in pre-op, and just numb the shit out of them because they're gonna be awake and they don't wanna give any fentanyl or Versed. So this is what I'll take to pre-op holding to hook up their fluids. There's another blood set here, which you can hook up to your second peripheral, but you probably won't even use it. Over here, so emergency drugs, there's like multiple of everything. 2 ephedrins. I only put 1 Esmol there because you have a 30 here that you'll use before aortic cannulation to like get the systolic less than 100. Bottle of nitro I made 4 baby syringes, but obviously 9 cc's of saline plus 1 cc of nitro makes 40 per. Then you got heparin. They want you to go ahead and calculate like the 40,000 units per or whatever it says on the sheet, so you know how much to give them. Your 30 of Esmol, 2 doses of antibiotics because one's for the start and one is when you get back off pump. This will be a 20 cc thing of fentanyl, 2 tens of propofol, 2 tens of rock, and lidocaine. And don't like deviate from this for the most part because they like are used to doing it all the same way, so everything has to be perfect. And then I usually from the pharmacy grab 6 vials of DDAVP in case they need that. I'll grab my epi drip, the insulin drip, and yeah, that's pretty much it. Just like literally follow the sheet exactly, and after you do it the first time it'll be fine. I make a sheet like this, which I can send to you guys. It just has like the patient info and then this stuff on the bottom, and I just use that to give report in the ICU. You'll also at some point need to make a transport bag because like with the LMA, extra tube, all the emergency rooms and stuff. But yeah, that's pretty much it. Mostly just like stuff to start your first IV if they're not in-house, A-line, lab stuff. Like you'll have to handle the swan, they'll do the central line. You don't put the OG tube in till the end because they're gonna stick the TE probe and that's gonna be like right here. You'll hook up all your shit after the central line is in. That will stay there. Dr. Slaughter likes to have a glide scope in the room. And then just like having all the drugs. And that's pretty much it.